Thank you so much, Lisa. And thank you also to Soraya for interpreting for us. And I want to welcome everyone. I also want to invite you to turn on your video. Some of you maybe came camera ready, somebody maybe didn't, but I do feel, and my experience tells me that when you have your video going, it's just so much easier to connect with people. I also want to invite you to feel free to use the reactions to tell me to slow down. I can get very passionate about CERC and very excited about CERC. So if I get to speaking too quickly, feel free to let me know. If you have questions throughout the session, you are welcome to put them in the chat, and Lisa Miller will help me to address those questions as we go along. But thank you again, everyone, for joining us. I want to start out by talking just a little bit about CERC and what its purpose is. When people are in a crisis state of mind, it can be very difficult for them to process information. They're thinking differently, they're acting differently. There's so many things going on in their mind. And so what we're going to do today is we're going to talk a little bit about what the principles of crisis and emergency risk communication, or CERC, are. We're going to then talk a little bit about how that's most relevant to you in your roles. And I'm sure, given the size of the room that we have going on here, we've got people in all kinds of roles, but with the same common interest of helping people to be safer and healthier in their lives in general, and this session specifically during emergencies. So as you can see on the screen, the first principle of CERC is be first. Now this one really applies to public health agencies, but also it is good to know that if you are the first one to get information out, people are going to tend to balance all the information they get after that against what you have told them. You're going to be setting the bar for what's true, what do I need to do. So anytime you can be the first one to get that information out, that is wonderful. Now, I've mentioned that this especially applies to government agencies because we recognize that with everybody walking around with their cameras, everybody being able to be an on-the-street reporter, you might not be the very first out with information. However, if it is in your lane, get out there as quickly as you can. Be the first one in your lane to share the information, because those media reporters, they are going to need to report a story. And if you can provide the information quickly, A, you're going to be that source that people are going to compare new information against. B, you're going to establish yourself as a responsive source of information. Now, the first principle is be right, but is be first, but the second is be right. And I'm sure you can immediately see that there's a potential conflict there. How do we be the first ones to get information out? How do we get information out super quickly, yet ensure that it's absolutely accurate? Because I'm sure you've all experienced it is much harder to change information that you've already provided to people. And at the beginning of an emergency, you're not going to have all the information that people need. And so one of the ways that at CDC we practice and we recommend that you can be right and still be one of the first ones to get information out is to acknowledge what you know, what you don't know, and what you're doing to find out more information. It's okay to say we don't have all the facts at this time. It's good practice, especially in an emergency, to say, at this time, we recommend that you do X, Y, and Z. Now, the next concept is be credible. When you are the ones who have the privilege of working directly with a community, you are going to carry a lot of credibility with you. There are still certain things that you can do to enhance that credibility. And if you're like me, if you're a step or two removed from the community and you're creating the messages that people need to make their decisions about their health and safety, you need to do everything you can to communicate in a way that they are willing to receive your message as the truth. One of the things that you can do to do that is to express empathy. We've Many of us have heard the saying that people don't care how much you know until they know how much you care. When you express empathy, you're connecting with the audience and you're helping them see that you actually have some understanding of what they're going through. Now, you can never fully understand that, but if they know that you have some idea of how they're struggling, they're going to be more willing to at least listen to your message. Number 5 is promote action. When people take action, they are reducing their stress, but also in an emergency, they're going to do something. When you promote actions that promote health, they are going to be able to be safer and healthier based on the information you're sharing. And finally, number 6 is show respect. Now, every time I teach this course and I get to show respect, I acknowledge that this seems like it should be something you don't even have to think about, that it's a way that we should all communicate with each other all the time. However, in the heat of an emergency, especially in some place like an emergency operations center, it can be very easy to take shortcut and speak very directly. And you do need to give messages that are short, that are easily understandable, but you also need to demonstrate respect, and especially with your audiences, because they're already in a state of emergency. They're already feeling some level of vulnerability. And so therefore, by showing respect, you're helping to reduce some of that anxiety that they're experiencing. I'm going to go over just a couple of these a little bit more in depth before we go further into CERC. First, talking about trust and mistrust. Now, one of the CERC principles is be credible. Now, there are 2 aspects that have a lot to do with communicating and conveying credibility when you are communicating. That's the expertise and the trustworthiness. And I know that seems like circular logic. Well, first off, with the expertise, that does tie into the be first. You need to be ready to share the information, and you need to be knowledgeable about the information that you're sharing. Now, one of the things we find at CDC is often people will ask us information that's outside our field of expertise, and we're happy to coordinate with partners to be able to direct people to the better source of information when it's not us. But trustworthiness, one thing we know is that when people perceive they have something in common with the source, with the spokesperson, then that can promote trust. Sometimes you have that, sometimes you don't. So if you don't have something in common with your audience as far as, say, demographics, you can show that you have something in common with them by the words that you use, possibly by the languages that you use if you have the capacity to communicate with them in their language, by being aware of what their cultural norms are so that when you're communicating with them, you're sharing information in a way that's not going to cause them to pause and ask, does this person really have my best interests at heart? And mistrust, it's an outgrowth of the perception that promises were broken and values are violated. We always encourage you to exercise caution when you're talking about the future. We even avoid the phrase when things get back to normal or it will get better, because you can't promise when it's going to get better. We do know that things are going to improve eventually, but people want answers about when, and we really can't offer that to them. But what we can do instead is offer them steps they can take towards better. And my screen seems to be frozen, so I'm going to stop sharing and get back. There we go. Express empathy. We talked about this already a little bit, and on my screen you can see where Dr. Nancy Messonnier, at the beginning of the response last year in February, was sharing this message with people, that being quarantined can be disruptive, frustrating, and feel scary. Now, people sometimes tend to balk when you say you may feel scared or we may feel scared, but you can acknowledge that it may feel scary, and people don't tend to balk at that. But acknowledging that there are strong feelings associated with going into quarantine. There are still very strong feelings about it. You know, we've seen that in the national discussions and the national actions. So acknowledging that this is a hard thing helps people think, okay, maybe I can do this. Empathy also builds trust. Now, one of the things I do want to say is in an emergency, every single message doesn't need an empathy statement. You don't have to start every single media briefing. You don't have to start every single community engagement with "this is a hard thing," but it is critical. It is extremely important that you do that at the beginning of the response. And then again, we talked about promoting action. When you're promoting action, make sure to keep the messages simple, short, and easy to remember. Cover your cough is something easy for people to understand. Even if you're an interpreter and you need to say this and you need to interpret it, or if you're speaking in another language, if the original content is in English, cover your cough is an easy message to turn into another language. In an infectious disease outbreak, people are going to be taking actions. And if they take the actions that will help stop the disease outbreak, you're going to stop the outbreak sooner. The other thing is self-efficacy is a predictor of behavior. If people think they can't help the situation, they're not going to try. If they think I can do something to help, they're much, much more likely to do something that will help the situation. And then finally, altruistic attitudes increase during times of crisis. We've seen this time and again. There is science to back it up that people tend to be more willing to do good for others when there is a crisis happening. So promoting action is not only something to help the people you're speaking to calm the anxiety they may be experiencing, but it's going to have real, concrete impact on the success of the response. So now the role, as I understand it, for many of the people attending a conference like this, is going to be somewhat preparing the messages, but it's going to be more in deciding which information and how to share it with the people that are in your communities. And so if you if you take a look and you're thinking about what should I say to people, one of the first things to recognize is that risk perception is not all about the numbers. Now, I work with a lot of statisticians, a lot of epidemiologists, and they can run the numbers. I can't, to be frank, but they can run the numbers and they can understand how high is this level of risk. But you know what? When I'm talking to my mom, when I'm talking to my neighbor, when I'm talking to my friend, how they feel about it is going to be equally important to the information that I can share. It may even be more important. And so when you see on this slide, risk equals hazard plus outrage, we mean like the numerical value, the level of risk as we can calculate it based on the information we have. But in outrage, we talk more about the heightened emotions. It's not necessarily anger. It could be fear or anxiety. It could be confusion. But outrage means the strong feelings people are having about the situation. And that's when you talk to them about risk. That's what you need to consider. You also want to consider that all risks are not equally accepted. If a risk is voluntary versus involuntary, it's going to be much more accepted. If you think about it, if somebody's accidentally exposed to radiation, they're going to be extremely angry about it. They're going to be extremely frightened about it. Yet, many smokers also know that smoking causes cancer. But that's a voluntary risk. They're not worried necessarily about the cancer, or they're not thinking about it so much. They're not fearful of it. Natural hazards are much more accepted than human-made hazards. If we go back to the radiation example, there was great tornadoes when they touched down in their areas. And then familiar versus exotic. If you recall back in 2014, 2015, when there were some cases of Ebola in the United States, people were very, very afraid of Ebola. They wanted the government to take swift, strong action, even though the reality was that there was minimal risk from Ebola spreading in the United States. Now, the list is actually much longer than what you see on this slide. But ultimately, as communicators, we're not trying to convince people not to be worried about something. And in many cases, in COVID-19, we want people to be concerned that they could catch COVID-19 if they don't take steps to protect themselves. And so our role is actually to help people fully understand the hazard and match their level of concern or outrage about that hazard with the actual level of hazard. And then finally, we have denial. Earlier, I spoke about the example of smokers. Science shows time and again that smokers believe that people get cancer from smoking, but that they won't get cancer from smoking. And I'm going to the next slide, and it is taking a second. And I'm going to go ahead and stop sharing and start sharing again with the next slide because I don't want to hold us up too much. So we talk about how people feel. There we go. Talk about how people feel in a crisis state of mind. It's not just about feelings. Their mind, when they're in a strong crisis state of mind, is less capable of processing the same amounts of information. So people may be less inclined to accept your message. They may deny that the situation is even happening. They may be feeling fear or anxiety or confusion or dread, in which case it's much harder to process that information. Worst of all is if they feel hopeless or helpless, because if they feel hopeless or helpless, they're going to be very, very unlikely to take action. If they feel there's nothing can be done to fix the situation, or if they feel maybe something could be done, but they don't have the wherewithal to take action, there's a good chance they're not going to take action. Now, one of the points I want to make here is that people seldom panic. We've all seen the movies of people running in the streets, screaming, not thinking. People may feel a sense of panic, but they almost never actually make decisions that are harmful to themselves based on that fear. What they do is they make the best decision they can based on the information they have. That's why as communicators, it's so critical that we get useful, actionable, accurate information to people. So here are some of the things as a communicator that you can do to overcome psychological barriers. When people are in a crisis state of mind, they tend to simplify messages. If you tell them a sentence that is 15 or 20 words long, they're going to remember 3 to 5. So if you can, pare your messages down, make them shorter, simplify them as much as possible. There's no need to use complicated words. It doesn't help them understand better, but also maintain the accuracy. People tend to hold on to their current beliefs. So if they always go to one news station for the news, they're going to keep going to that station, and they're going to believe what is consistent with what they already know. Their world is in a state of upheaval. They want to hold on to what they know. So by using credible sources, they're going to be more likely to receive the information, even if it's different from what they already know. Now, this one may seem to conflict. People tend to look for additional information and opinions. That doesn't seem to go with they hold on to their current beliefs, but it's how people actually do act. They hold on to their current beliefs, and yet they'll still check 3 or 4 news stations and Facebook and call mom and ask, is this the same thing you're hearing? And if people are getting the same message everywhere they go, then they're going to say, okay, this must be the truth. And then, as mentioned earlier, the value of being first, releasing messages as soon as possible, is because people tend to believe the first message. So, as mentioned earlier, we want to use plain language. And here are some tips for how you can make your language easier for people to receive, easier for people to understand when they're in an emergency state of mind. First of all, be brief. Be as brief as you can. Now, you can see below we have the example. Improve how your mask protects you. Now, if you followed that information closely, you saw there was a whole scientific publication, an MMWR, on that. And if you read it and you're a science person, it probably wasn't too hard to understand. But if you're not a scientific person, there was a lot of information. that didn't boil down to the bottom line. The bottom line was that study told steps that people could take to improve how the mask would protect them. And so as a communicator, we took the science, we worked with the scientists to make sure it was accurate, and we said, how can we simply state this message? Now, if you go to the webpage associated with this image, there are simple steps. They're written simply for people, and if you want the deeper science, you can access that. The other thing is to give positive action steps. The way I like to remember this is do statements work better than don't statements. If people are in a burning building and they read a sign that says, don't take the elevator, if there's a fire, the next question is, well, what do I do? When you're trying to escape a fire, you don't want to waste that even 1 second processing that information. So if instead we say, in case of fire, take the stairs, that's going to help people understand the information more quickly. Now, that's a very simplified example, but it's one that's easy to take away and think, how do I apply that when I'm giving people guidance? You know, I could say, don't go to the store without your mask, or I could say, wear your mask every time you go out of the house. You know, one of those is much easier to follow. Now, use words your audience uses. And that is has a lot to do with tailoring. When we're talking to average community members, we're going to talk like we talk in every day. But if I'm talking to a group of laboratorians, I'm going to need to understand the vocabulary of the laboratorians. If I'm talking to a group of doctors, I'm going to want to find that middle ground, because doctors speak to people who use everyday words all the time, and they read information and communicate with each other with much more complicated words, and they're very short on time. And so if we keep that in mind, a lot of times I hear from the scientists, well, this is for a clinical audience. Well, you know what? Clinical audiences are short on time. If we can get to the point quickly, simply, we're going to help them do their jobs better. And then using personal pronouns. Improve how your mask protects you. This could be rephrased as ways to improve how masks protect people. But by using personal pronouns, a couple things happen. One, I make it easier to understand. Two, I understand this is for me. And so it's going to make me more likely to want to learn that information, understand that information. Now, does anybody have any questions so far? I haven't heard any, but I know I've covered a lot of ground. What we've covered so far is actually probably about a third to a half a day course. So I want to make sure that if anybody has any questions, we do take the time to answer them.
And please feel free to enter your questions in the chat. We don't have any at this time, but please feel free as we go along to enter them. Thank you.
Thank you. And so we talked a little bit earlier about tailoring messages. Now, there are large audience segments and smaller audience segments within those groups. At the beginning of emergency, you might just have to get the information out and then consider tailoring it better for audiences as you go along. But the more work you can do ahead of the emergency to consider who are the groups I need to talk to. Do I need to communicate with people who work in fisheries in any way differently from people who work in the fields? That's going to be a way that you can consider. The people in the fisheries, they may be listening to the radio all day. The people working in the fields may not be able to do that. So how am I going to get the information to them if there's an urgent situation? Now, and continue to base your messages on key messages. Even though we're tailoring, every audience should be getting the same basic messages, because every audience needs to take the same steps to be safe. Now, there's also the aspect of culture. So, for instance, when one of my colleagues from California shared with me a story about how a community organization had put together care kits for their Asian American community members. And in those care kits, they put some tea, and they put some Lipton tea. Now, I am in no way saying anything bad about Lipton tea, but when the community members received those care kits and they saw that tea that was not a comfort item for them, it didn't have the same value as when that organization later switched to using a tea that community members were much more familiar with, a brand they recognized. Now, I'm not saying that you always have to stick to a certain brand, but what I am saying is think about what's familiar to your audience. What does your audience identify with? What are the do's and don'ts in communicating with and living next to and working next to members of that audience so that you can be sure that your message is most likely to be received. And I will give a little shout out right now. This La Máscara contra el Virus is a wonderful PSA. And so I encourage you to check out the link and check out that video. When you get to that page, the Ad Council page, you're going to see a lot of options for videos. So you'll just scroll down to find that one. I just like it because it's fun and powerful. The language they use in that message really resonates with the audience they're trying to reach. Now, CDC, if you find yourself in the role of creating messages or tailoring content for the people you're communicating with, CDC has resources to help you do that. At the beginning of this presentation, I talked a little bit about CERC and how to communicate when people are in a crisis state of mind. We have an online course that's about 3 hours long. When it's not COVID time, we are able to go to different organizations and present day-long or sometimes even longer CERC trainings, depending on the need of that organization. So you can always reach out to us and ask, do you have any help for me to tailor this? Do you have any recommendations on how to approach this? You can reach out to Lisa or you can reach out to the CERC program. There's also the CDC Clear Communication Index. Now, I didn't include an image of that here because it's not that easy to see when I put it on the screen, but I absolutely love this tool. This tool is a quick checklist to ask yourself, am I communicating as effectively as possible? Is my main message at the top of my resource? Do the visuals that I have in this resource throughout support what I'm saying in the message? Am I giving positive action steps? Am I using words that the people I'm trying to communicate with use regularly? So I found that the first time you use this tool, it might take you a half hour or possibly even longer to use that tool. But now when I use it, it usually takes me 5 to 10 minutes for each material that I'm evaluating. So I do encourage you to check it out and see if it's useful for you. Then there is a list of everyday words. CDC has made an effort to take those big sciencey words and turn them into words that people use in normal speaking. So if you need any support with that, you can check that out. And then there are resources to help with health literacy. Now, this is more for people who are doing an evaluation of the communication needs of their audience, but it can also be helpful for understanding one of the things that there's a big difference between health literacy and literacy. People, even highly educated people, sometimes have trouble taking away exactly what the doctor told them to say. Or sometimes you may have looked at a prescription bottle and known that the doctor and the pharmacist are speaking another language to each other and you don't know what it is, and what you need is the bottom line. Take one pill twice a day. Now, pharmacies have gotten a lot better about that than they used to be, but if you've also looked at, say, your health record from a visit, or you've looked at the prescription that goes to the pharmacist, you might be looking at it and scratching your head. So the point of all that is that people need to understand the health information in order for it to be actionable for them, and the resources at the health literacy site can help with that. So now, you've done all this work to consider, what does my audience need? You've done all this work to think, okay, they need this information. Here is how I'm going to present it to them. Now, what do I do? How do I get that message out? And here's where you guys are the experts. And we're going to be talking in just a few minutes. I'm going to need a high level of audience participation on this, but I'll go through a few tips first. One is work with others to share the messages. The little piece of screenshot that you see in front of you is from howrightnow.org. How Right Now is an organization that contacted experts from all over the country to ask, how do we best help people cope with the stress, with the grief, with the turmoil, with all the mental health challenges related to COVID-19. And here are just a few examples of resources that you can access. You can see that CDC helped contribute to this. And one of the things that I'd like to point out here is that CDC did provide some of their expertise, but also what we did is we reached out to our partners. We reached out to our partners to say, hey, can you work with How Right Now to give them better insights to make sure that the messages they're sharing, the materials they're creating, meet the needs of the audiences they're trying to reach. So now, whenever possible, you want to establish those relationships before the emergency. My team has actually had an effort going on for years. That is how I actually got to know Sylvia at the National Center for Farmworker Health, was by trying to establish those relationships before the emergency. So when the emergency happens, that we can actually work with each other to ensure that people are getting the information they need. And that's not just CDC saying, hey, share this message. That's also us saying, partners, what do you need? What are you hearing? What questions are you consistently getting? And so when we hear that sort of information from our partners, we are able to take that back to the emergency response, and we're able to say, hey, we need this. Hey, people are confused about this. Hey, we need these resources in this language. So another thing that you want to do when you're sharing information during an emergency is promote repetition and consistent messaging. I mentioned earlier that if people go to 5 different places to find out the answer to a question and they get the same answer 5 different times, they're going to trust that message. So one of the things that you can do is you can ask your partners, would you share this message? You can coordinate with your partners to say, what is the message people need? You know, one of the things that we heard in the Ebola response very early on, a strong message was wash your hands to help stop the spread of Ebola. At the same time, we heard from people in many communities, we have no water. How are we supposed to wash hands? And so we coordinated with the communities, we coordinated with the governments and the other partners participating in the response to figure out ways to get people hand sanitizer and hand washing stations with information on how much bleach to add to the water. In the case of COVID-19, we've created these communication resources that are there available for everyone to use. And we'll take a look at that page later in this presentation. But here's the collaborative part, the highly interactive part. You heard this morning at the plenary, hopefully, that Alfonso was talking about this cooperative agreement. This is going to be an outstanding way to meet the needs of farm workers. We're super excited about it. I saw that Silvia Partida was participating earlier. And Silvia, if you want to mention quickly your take on it, otherwise I would invite other people to tell us, what are you doing that's working in your community? What are you doing that you have seen to be effective? And so if everyone can have the opportunity to unmute themselves and then take turns unmuting, I'm going to stop sharing for a moment so we can see each other and talk about what's working in the COVID-19 response. So, Nick, is everyone unmuted? Or had the ability to unmute themselves, I should say. It'd kind of be noisy if everyone unmuted at the same time. Mari, would you like to share?
You know that I will, Lisa. I'm very fortunate to have a great team, senior staff. Our chief clinical service officer, Dr. Poquet, has done a great job keeping us safe, contained, following procedures and protocols, and she has been in touch with CDC and DHEC, and we get the numbers from her And we plan accordingly to, we have regular Zoom meetings, and we get what are the real numbers. Now, in regards to my farm workers, I continue to be very careful, although I'm vaccinated. Yay. And I hope that most of you are too by now. Like this morning, we were talking about, I have 100 farm workers in the area right now. We were planning to do vaccination on the 31st of March. Unfortunately, we couldn't get the Johnson & Johnson because that's the vaccine that it's up and it's in style now. So, but my farm workers are going to be here until August, so I can go for the Moderna and or Pfizer through my clinical chief officer. So we were talking about that this morning, and it does bring the question that while we have in our hands the fate and the health of farm workers and people that are wanting to have the vaccine, but we don't have the one that they think they're going to get, but they're going to get it, they're going to get vaccinated against COVID. I'm also struggling with some of them don't want the vaccine, cultural and traditions and thoughts they have. So I'm trying to be very science guided, all about science, all about facts, all about what is going to stop the disease, the virus. So in other words, we are following very closely what the South Carolina Primary Health Care is telling us, what DHEC is telling us, CDC through our officers.
Wonderful. Thank you. And I hope the information that you found is helpful, because we really try to make it useful information.
Correct.
Thank you.
Very, very simple, no complications, no complicated.
Well, thank you. That's glad to hear.
You're welcome, Lisa. Thank you.
I see that G. Bird has a hand raised. Would you like to ask a question? Or I'm sorry, tell us your practice that's working well.
Sure. My name is Gina Bird. I'm with Greene County Healthcare. Hey, Maury.
Hi.
We're a neighbor to them. We're in North Carolina. We're in the eastern part. Basically, we've been working very closely with the North Carolina Farm Project in North Carolina, as well as the North Carolina DHHS. And we're very fortunate to get Johnson & Johnson. And we're getting about 100 a week just for farm workers. Nice. And I'm vaccinating all of them, and we're doing it in the evening. So basically what we've done, we've set up several sites that are at our clinics, and we've been very fortunate also to work with the agriculture extension agents from each county, and the state has broken it down by county. So I've got about 4 or 5 counties I'm working with, and the ag extension is working very closely with the growers to have them to call me. And then what I do is we set up the time, and we have a COVID team that goes out and educates the farm workers and talks to them ahead of time, gets their paperwork lined up. And then we have a vaccine team that actually works the evenings giving the vaccines. Johnson & Johnson vaccine has been great. Just doing the one shot has been wonderful. But we've been doing it probably for the past, I think we've done it for the past 3 weeks, doing the vaccine. So it's been a good thing.
That is wonderful. Thank you for sharing that. So I'm so excited when I hear that communities are getting the information they need so that they make the decision to get vaccinated. Does anybody else have anything that they could recommend to their colleagues that's worked well for them? I can tell you we've been meeting with the APHA Latino Caucus, and it has been wonderful to hear from our partners on those calls about things that they are doing. Mainly what it comes down to that we've been hearing is people, each of the partners on that call understanding the needs of their audience and then presenting and sharing the information in a way that meets the needs of those audiences. So what about challenges? Oh, go ahead, Marty.
I wanted to commend Gina about the vaccination sites and immediately, vaccinating the farm workers. I was wondering, how was the reaction, Gina? Do you have any problems?
No, we really have not had any problems. I have had a couple that kind of wanted to wait to see what the other H2A workers, how their reactions were.
Right.
And so a lot of times they'll call me back and they'll say, oh, I've got one more guy that decided since the other guys did well that now they want it, which is fine. The growers are actually getting it themselves.
Yes.
So that's a good thing because they show that they're doing it as well. We did have some incidents last year with, we did testing. Actually, our group did actually testing since June up until, like I said, we just started the vaccines a couple weeks ago. So some of the H2A workers actually came, may have been involved with having COVID last year. Mm-hmm. And if their coworkers saw that, then it makes them kind of want to go ahead and get it as soon as they got back. Some growers had it, which made their workers actually want to get it as well. So what you mentioned is about the same as we have here. And I think that's going to be across the board with some people not wanting to get it, but it's been pretty positive. And I think the further we go forward and as easy as we can make it for them to be able to get it, then that's works out great.
Great.
Thank you, ladies. And I see that Alicia Roth also wanted to contribute. Alicia, I saw you took your hand down. I hope I haven't put you on the spot.
Yes. Yes, I briefly would like to share. At the beginning of the pandemic, I'm with the Kansas statewide Farmworker health program, and there is a percentage of our clients that speak low German, and they needed access to the information in their language. So it was late April in 2020, like we just recorded in low German a message for them, basically just to summarize the CDC recommendations and also to mention the link for them to go. Some of them can read English, a little bit of English or a little bit of Spanish because they come from an area in Mexico. So that was a tool that we've used last year. And we are probably going to be using that too for promoting vaccines. And we sent that voice message by text. So they had it there and they were able to listen to that message as during that time because there was no material for them to get the recommendations for prevention back then in their language.
Wow.
That's great. Now, it sounds like you probably knew before this response even started that you had people who spoke that low German. Is that correct?
Yes, we have a couple of people in our team that speak low German, and we were able, with their help, to translate some of the CDC basic recommendations. And it was just a 2-minute message. But it worked out good.
That is wonderful. And I looked at the clock. Apparently, I talked a lot. I would like to, one of the main things I'd like you guys to get out of this this session is to be able to navigate the CDC website. It is enormous. And I know that it's enormous. So I have gathered some materials on a resources list that you should have access to. If not, then we can find out how you get access to it. I'm going to share that very quickly. And then I'm going to take us over to the CDC website just to show you a little bit about how to get around it to better be able to find what you need. So let me get back to screen share. And here is a resources list, and you can see up at the top I have the communication resources that were on the slide, as well as plainlanguage.gov. Then there are all kinds of COVID resources. So I just tried to pick the ones that I thought could be most useful to you, and we'll visit some of those on the website as well. But then there are others like the social media toolkit, the guidance documents that we won't visit today, but please know that they're there in case those are useful to you. Also, there's lots of partners that have been creating some tremendous resources. I talked about the Ad Council, Lucha PSA, as well as the Hell Right Now mental health resources. Switchboard has done a roundup of multilingual resources, many of those from state health departments. So many thanks to the state health departments that have developed those, because at CDC, we have to prioritize certain languages, not because they're more important than others, but because we have to try to meet as much need as possible. Of course, Spanish is one of those. We have millions of Spanish speakers in the United States that do not speak English, but we also have to work with partners to make sure that the needs of some of the smaller groups are getting met. You know, I'm pointing out also the National Center for Farmworker Health educational resources, because those are available in several languages, including indigenous languages. And you can also get more information that's been reviewed for cultural appropriateness from core COVID-19 resources. With that, I'm going to stop sharing and get back over to the website. And from here, we are at the CDC COVID-19 homepage. We've tried to make it easy to find the information that you want here. At the same time, the audiences that you are serving are going to be able to get information that's even more specific to them. And so one of the first things that I want to point out is the languages. We have much of this website available in Spanish, Chinese, Vietnamese, and Korean. We have some resources available in other languages, and those are going to be right here on this page. One of the things I'll let you know about this page is it's very helpful not only for COVID-19, but we have resources about many different topics. So if you go to the COVID-19 website and click other languages, you can get to that page. You also might want to bookmark it. We also have videos in American Sign Language, and then we have some resources that are easy to read. I'll visit that page for just a moment because I want to show you that these are super simple, basic black and white. That is intentional. It's not as colorful and eye-catching, but the audiences for whom this was particularly intended, people with extremely low literacy. The feedback we got from the audiences is that was the best way to present that information. Now, another resource that I would like to share with you is information for agricultural workers, as well as farm owners and such. So if you go to specific industries on this page, so I went to work in school, then I clicked on specific industries, and then I can get here, and you can see there are some different industries, and agricultural workers and employers is listed under food services. So if you wanted to check out that page, you can find out, is there any information that's useful for me to share with my clients or to share with the employers of my clients? Another resource that I would like to share with you, and I'm going to go back to the COVID-19 homepage. To do that is the communication resources. On an earlier slide, I talked about the communication resources so that we can ensure that we have consistent messaging. And so I'm going to go to more and click on communication resources. And you can see there are all sorts of things. There are PSAs. Guidance documents may be a little heavier, but they're there if you want to check them out. There are videos, and on the videos page, you'll see that you can also sort by language, or you can sort by audience. Now, we don't have videos available in a wide variety of languages, but we do have English, Spanish, and American Sign Language. And I'm going to go back to the communication resources page. Maybe. There we go. And you'll see that I'm also using the left navigation pane quite a bit. Often that's the easiest way to find information once you start getting deeper down into the website. There are also print resources, and those are very helpful. A lot of times people ask us, they say, I want to print this off to take it to my clients. They don't have internet at home, and I'd like to have a printout for them. And so that you can filter by audiences, including general public, and you can also filter by topic. And you can see that a lot of those resources, especially the ones with the most general or basic information, we have in lots of languages. So hopefully you find some of those useful. There are, for example, flyers or mini posters you can put up, all sorts of things. We could take a couple of hours just going through everything in that section of the site. Also want to go to vaccines because I know that's a big topic. And I know a few of you have talked about people having concerns about vaccine safety. And I'm going to actually go to the view more here because I'd like to show you that we have vaccine information for, here we go, for specific groups. We have information for people after they've been vaccinated. We have information for people to know what to do to prepare if they're not sure about it. So, and for healthcare workers, to address that vaccine hesitancy, you can visit the Vaccinate with Confidence site. And when I say healthcare workers, I'm probably talking to everybody on this call because we all have a role in helping people be healthier. And so if you are making health recommendations in any kind of way, this site likely has useful information for you. So you can go to the Vaccinate with Confidence site and you can learn more about how to work with people for them to be confident in vaccines. If you're trying to figure out how big is the risk at my community so that you can better address that risk, you can go right there to the Rapid Community Assessment Guide. Now, I know I need to leave a few minutes at the end of this presentation for housekeeping. So, Lisa, do I need to turn it over to you at this time?
I'm just wanted to remind everyone that I'm about to put the evaluation link in the chat. So we do ask that you take a few minutes to complete the evaluation and provide some feedback, and that will assist us in future trainings. And also we did have a couple of comments in the chat. Lorena shared a resource that is, she said, at Nuestra Comunidad Sana, the next door, we've developed web fotonovelas on COVID stress and COVID fatigue using audio for radio. And then they've also developed a video encouraging people 65 and older to get the COVID vaccine using audio for radio. And the link is in the chat. So thank you, Lorena.
Thank you.
And there was a question for Madi as a follow-up also on what percentage farm workers wants to get vaccinated at this time. They were just curious. So if you could answer that, Madi, thank you.
And I will also, I noticed that I was looking at the time thinking this was a 60-minute session, but this is actually 90 minutes. So we have a good bit of time yet. So I'm so glad I was mistaken, and my apologies for the mistake. Mari, I see the lávate las manos. Did you want to answer the question at this time? Oh, I like that one. I've seen that one. The mantenga calma. But we don't hear you, Mari. Can you unmute? Nick, I'm not sure if she can, but if she can't, would you unmute her?
I ordered these. This is only 2 left because they're in my office. The CDC has a set of posters that are really great. You know, they broke away from the old posters format, and they're really cool. So if you guys go to CDC, you can order. They have the one for the germs, wash your hands. And I expect from my farm workers, I mean, you heard Gina, she's having vaccination sites. I want for my farm workers, they're my, to at least an 80% of them could decide to vaccinate on the 31st. And then I have a time to kind of convince and give more facts to the 20% left. Let me tell you something, Lisa, guys, I don't know you guys, but I haven't seen the growers so nice and so cooperative with me ever before. As soon as I told them we're going to vaccinate the farm workers, they had a smile that I have never seen. And I go, why can you be this nice? And I hope we don't have any growers with us in the presentation, but it is nice to have the cooperation of the growers. And yes, they're very, they are emphasizing that they would like for them to do it, but they're not making it mandatory. And actually, because they have a contract, I don't know if you guys heard about these, the H2A workers, they have to sign a form where it says that they're not being obligated, or it's not mandatory to get the vaccine, especially the ones with the H2A working visa. Does that answer your question, Lisa? I was so happy when I heard that the farm workers were going to be getting the vaccines. I mean, I was dancing in the streets, I mean, it's like, wow, they're finally recognized as essential workers. That's how we, the governor in South Carolina listed them. So come on, join the crowd. But they're really reluctant. That 20% is really not convinced. I have some coworkers that don't want to take or get the vaccine.
Mm-hmm. Yeah, we're seeing that a lot. I mean, and there are very valid reasons for people to have concern. I mean, in any case, if people are uncertain, their reasons for being uncertain are certainly valid. And one of the things that we can do is continue to build that relationship, continue to be the sort of person that hears them so that they will hear us.
They're waiting for the Johnson & Johnson. I know that. That's what they're telling me and our, other coworkers. And I respect that, 1 doses versus the 2. It was tough for me. That vaccine was really tough. But I survived it,
Well, I'm glad that
Thank you guys. Thank you. It's been a great presentation, and it's good to be with people that you usually see and can hug and talk, but now we can see over the computer.
Absolutely. That's one of the reasons why I like video. I understand. It took me some getting used to it for the video, but I was so glad that I was mistaken that we actually have 30 minutes more. So what I would like to do is go back and show a few more resources and then continue our discussion after that. So especially because I wanted to go a little bit more into that rapid assessment guide. So I'm going to go back to sharing my screen. And And first I'm going to go to the Rapid Community Assessment Guide. Now, you can see that it says that state or local health departments might be users of this guide, but also in this list, there's all sorts of people, hospitals and clinics, health systems, other organizations who are working to increase the vaccination uptake. And so it sounds like some of you have already laid this groundwork. You've already understood what the need is going to be in the communities you serve. But if you haven't, or if your work allows you to expand beyond the people that you usually work with, or maybe you want to share this resource with your colleagues, to help them identify which communities are at risk for not having much vaccine uptake. And maybe they can use this toolkit to understand how to reach the communities, how to assess which communities need to have more resources focused as far as identifying trusted messengers and community leaders. Because remember what we said, people are going to go to a lot of places to get information, and if they get consistent information across the board, if their community leader is telling them the same thing their spiritual leader is telling them the same thing their friends are telling them on social media, then they're going to be more likely to believe that message. So this guide helps you understand where there are going to be challenges getting people to take the vaccine and some of the steps that you can do to help address those challenges. So I'm going to close that right now, and I'm going to go back to our COVID-19. And actually, I'm going to navigate to our homepage. If you go to cdc.gov, if you remember nothing else, cdc.gov will get you to the COVID-19 resources. I want to show some resources that we have under the category of healthcare workers. I know there are a lot of people on this call that are promotores de salud or our community health workers. They are there to meet the information and health needs of the community. And so we put the people who work in those sorts of roles in the category of healthcare workers. Now, I will let you know that getting the information for community healthcare workers, you got to dig a little bit there. So if you remember that they're healthcare workers and you go to that page, and then it seems rather common sense that they work in non-hospital settings. So you're going to go to more there. Now, we would love to make everything that people needed as front and center as possible. But as you can see from the site, there are so many different ways that we're trying to get the information out, so many different groups of people who can use the information. So with for the community health workers, we put that information under public health clinics and services, and you can go to the community health worker resources. Now, I know I'm sharing a lot here. That's why I put together the resource page that I showed at the beginning, that PDF, to make some of these easier for you to find. But here we have resources for community health workers, community health representatives, and promotores de salud. And I will let you know that we were thrilled to see this section of the website go up because one of our colleagues kindly connected us with the National Association of Community Health Workers. And when we discussed with the lead over there, Denise, some of you may know her, she told us the clinical information doesn't work for us. The lay audience information doesn't work for us. We need something in between. Now, I will be the first to admit, we would love to have gotten it together, gotten it out, gotten it in people's hands faster. But I'm thrilled that we have it, and I'm thrilled that we developed this as a response to a need expressed by our partners. So I do encourage you all to check this out, to see more information specific to people who are not in a clinic receiving patients, but rather going to people's homes or meeting people via Zoom. If you're meeting someone by Zoom, then that personal protective gear is not going to be as essential, but there are going to be times when you need to go out and meet the community face to face. You know, this kind of job takes its toll on responders as a whole, and there are unique challenges for self-care and mental health care for people who are working in those kinds of roles, community health workers, community health representatives, and promotores. Adapting your practices. This sort of information was developed in conjunction with our partners, them helping us understand, us having information on the numerical measurement of the hazard, but then working to figure out what is actionable for people who are working in these roles. There's also training and support, information for employers, and communication tools, because people who are serving in the role of meeting the direct needs of community members are generally working for somebody in doing that role. So their employers have information on how to keep the employees safer. So that is another one that I especially wanted to share with everyone on this call. And then let's see, I'm going to jump over to the Ad Council. The Ad Council actually has a lot of different resources. One of the great communication collaborations in this response has been with the Ad Council. And so they have resources. They have an in-depth data on different audience segments across the country that they used to decide, how are we going to message about this? How are we going to support the country as a whole in getting information out? There are people who prefer to listen to the radio. There are banner ads that people can put up on their website. There are print materials. There are all sorts of resources, including live announcer copy. I know one of the things that I've heard from some of my colleagues working with tribal audiences is that live announcer copy can be very, very helpful in getting the information. So if you do need to record a PSA, you could check out the resources here. It was mentioned earlier about taking the basic CDC messages. Of course, the key messages exist to be able to find things. But if you just go to the assets, you can look for all sorts of information to meet the needs of audiences. And I think I'm going to leave that there for now. And close that. And
Lisa, how about
yes,
the videos? Are you gonna show us some of the YouTube videos that you mentioned at the beginning?
I was I am not going to play the videos because they don't tend to play as well with Zoom. But I will. Let me navigate to there. Let me get there quickly because I'm having a little trouble here. There is a whole COVID-19 in Espanol playlist from CDC.
Good. That
you can play. And you can see these are in short segments. We actually created these to be shareable via social media. You know,
nice.
A minute and a half is a little long to send as a text message or a WhatsApp message, but it will go. And then, of course, we have shorter ones too. Oh, I'm so glad to hear that you find those useful. These are actually clips from a much longer webinar that we did, and our partners working out in the field came back and said, these are great, but I can't send it via WhatsApp. Can you cut them into short pieces? And so we did. So if we go back to.
Never a dull moment when you're doing outreach.
I know, exactly.
Never.
Exactly. I am. But the lucha one, I don't want to get everybody seasick, but you can see we have Sesame Street,
nice.
We have You Will See Me, and the COVID-19 myths, and there's the lucha one. I love it. I would share it right now, but I know that the audio and the video quality degrade when you share it via Zoom, so that's why I'm not going to share that today.
That's okay.
And then let's see, there was the one-stop toolkits. If you serve groups of people that fall in any of these categories, businesses and workplaces, childcare programs, community and faith-based organizations, that's a big one that is likely useful to you. You can find where we've gathered information for that audience into one place, because we understand with the website being as big as it is, it could be hard to find all the resources that you want. So we tried to meet the need in both ways, making the site as a whole as navigable as possible so people can go all over to find what they want, but also to take the pieces that a group of people is most likely to want and gather it in one place for them. So, and there is one more that I wanted to show you. Resources for people for limited English proficient populations. And you're going to find that under Your Health. Your Health, if you go to the homepage, you're going to find that as well, and you navigate to Your Health. And actually, why don't I do that live while we're here? So go to your health and people at increased risk. Now, just because somebody doesn't strongly speak English doesn't mean that COVID-19 is going to affect them any more strongly. But one thing that we do know is that people who do struggle with English also face many other risk factors. They, first off, don't have as easy a time getting the information. They may not have as easy a time getting to the doctor. They may have to take public transit. They may not have the resources they need to eat in a way that can prevent diabetes. And diabetes is one of the things that can worsen COVID-19. So if you go to this page for people at increased risk and you open up that navigation pane right here, other people who need extra precautions, and you scroll down there, you can see resources for limited English proficient populations, including migrants and refugees. And those are actually all of the resources that I wanted to navigate to today. There's hundreds, there's thousands of pages. If there's something in particular you want and you don't find it, please email us and we will help you find it. If it doesn't exist, just as we did for the community health workers, we will go to our experts and we will say, this is a need. Can you help us fill that need? We actually had an organization from Florida, a community organization in Florida, contact us and say, we're not finding enough resources in Haitian Creole. We need this and this. Can we get it in Haitian Creole? Now, we cannot fulfill every request that comes to us for translation, but we are going to do everything we can to meet the need. And in this particular case, we knew these folks were in Miami, in the Miami area doing direct community outreach. Almost all the Haitian Creole speakers in this country are localized in the Miami area and the New York City area. And so we knew this was going to be an effective way to meet the people who weren't going to otherwise have access to this kind of information. So with that, we have about 15 minutes left, and I would like to hear more from you about your experiences, about your needs, about what's worked for you. And I am so sorry I cut it short earlier for my mistake, but I appreciate y'all hanging in there with me for it. So would anybody else like to chime in? Mari, did you have anything else you wanted to share, or does somebody else want to tell us about a practice that has worked for them or resources that they find especially helpful?
There are other people out there that want to talk too.
I see, and this isn't like in a classroom where I can look them in the eye and point at them.
Right, kind of pressure us like you have right now. But I tell you, I took from your presentation what I have liked it so much, and it has kept me so, participating and interested, is that the research that you have done with these resources, navigation of all these materials. Sometimes we don't have that time. So I'm going to go to your presentation and see what am I going to take so I can make my 100% farm workers, migrant and seasonals vaccinate for the COVID-19. I also, and I want to share these with my colleagues. I tell them that we're part of history. It's not only science, it's history of the world. I mean, we are creating history. I look at you and I said, listen, you are not sick because you are following these things. Mascara, goggles, or lenses, we are telling them to protect their eyes because the virus can go through your eyes, water, and we don't want them touching their eyes with their dirty hands. So we have given them sunglasses, goggles, that you can put, because even the dust, bandanas to protect their ears and their necks. and telling these little things to protect themselves, It's not only the 6 feet, now it's not 6, it's 3, I think. Don't let your guard down,
Yeah, I think that's just in schools. So based on the spread of the disease.
Okay, yeah. Used to be a teacher, not anymore, thank God.
Well, I see we have a couple more questions. Bernie, I'm going to get to you in a second. I see a question from Jose about how the Ad Council is related to CDC. And Jose, the White House actually initiated a collaboration with the Ad Council and then brought CDC into it. Now, Ad Council does work with CDC on other things as well, but basically Ad Council has an interest in getting accurate health information out, and so they work with CDC to get that information, and then they take it and they turn it into these beautiful, snazzy communication resources. So, and then I see Lorena, did you want, I saw your screen light up for a second. Did you want to ask directly or for me to address the question in the chat?
Hi, Lisa. Thank you for your great presentation. And hi, everybody. Yes, I just wanted to call out that there were questions in the chat and asked if you could address those for us. Thank you.
Absolutely. So I am going to try to answer your question at this time, Lorena. There are a few things. Now, as far as for Latinx Spanish speakers, they are tailored for Spanish speakers. Fortunately, they're not all just translated. But, and actually what we try to do is create materials that can address the needs of a broad range of people. Sometimes we can tailor specifically for segments within an audience, but some of the things you may be thinking of the social media toolkit, which is also available in Spanish right here. And so you can take these resources and do posts on your social media. And then we have, as I mentioned at the beginning, most of the things that we have in English that are for lay audiences, we don't have all the scientific publications in Spanish, but we have a lot of the materials that are non-scientific in nature for Spanish speakers. And so you can always check out a page that goes there. And then that same kit that I just showed you for people with limited English abilities, we do have that kit also available in Spanish. So those may be some of the resources that you heard about. And I will also look around if I find that there's anything else, a new kit being developed specifically for Latinx Spanish speakers. I will find a way to share that with the hosts so that we can get that to you. Or you can also email me about it. So. And then why don't we go over to Bernie? You've had your hand up for a bit. Let us know what's on your mind.
Hi, I'm Bernie with Oklahoma, or out of Oklahoma. I actually was going to reply regarding what was a good communication tool, and that was being given the opportunity to participate with the cloth mask campaign. It appeared that it was presented, the opportunity became presented right at the introduction of COVID, and us having those masks readily available really provided a measure of not only comfort, but a confidence to know that not only do I go to that clinic for my medical need, but that we were right on top of things, to know that we were also going that extra mile to care about the immediate concern of COVID. Thank you.
Thank you so much. Yeah, it's, COVID has affected every single aspect of everyone's life. We put a lot of emphasis on the value of mask wearing. We do know that it helps to save lives. We put a lot of emphasis on the mental health aspects, but what we also know as people need food. If we want them to take time off of work, they've got to have a way to pay their bills, to provide for their families when they're taking time off work. There are partners across the country that are working hard to meet those needs. And we work with our partners to try and get the word out about that. So I see that Luz Maria had the question about what sort of identification are farm workers asked to present. And that actually is going to vary from jurisdiction to jurisdiction. And so the best thing that you can do is talk with your local health department or the state health department, if more appropriate, to find out in my area, what are people going to need? The CDC has worked very hard to help people know that everyone needs this vaccination if, as a nation, we are to be stronger. And that actually has nothing to do with the type of work or the language or whether somebody is documented or not. If we are all to be safer, we need to all be vaccinated.
And we do have about 5 minutes left in the session. So I did include the link in the chat for the evaluation. And I also wanted to respond to Socorro. She was asking about the link for the recording of the session. And that will be available after the conference. And you'll use your login that you used to log into the conference for that. And you will receive a follow-up email message with instructions as well.
Well, thank you very much, everyone. I'm going to give you a couple minutes to fill it out. In the meantime, I am putting a couple of email addresses in the chat. epic@cdc.gov is my team. If you email that address, you will reach my entire team, and that is the fastest way to get a response. Of course, if you feel more comfortable emailing directly to me, then you can email me at hsi0@cdc.gov. So, but thank you so much, everyone.
Thank you. This was good.
Yes, thank you all for the work that you do. I'm honestly quite jealous of your ability to be so much closer to the community, but I know it takes all of us, but I'm more impressed by your work. Thank you.
Thank you. We need people like you guys out there too.
Oh, thank you. Well, I do love my job, but my favorite part is when we go into communities.
Yes. I know you do. It's amazing. Our job is really amazing. And you know, I didn't know how much I was getting my family involved. I've been doing this for 20 years, right? I have a 25-year-old, my daughter, she graduated from Appalachian State, and she's doing some research in chemistry. And she was invited by University of Connecticut. I'm sorry, it's like I'm fuming because I'm so proud of my girl, all of them.
Don't be shy. That's a good reason to celebrate.
But I have to tell you, because when she told me in the summer after the graduation, she was invited by the University of Connecticut, all pay, tuition, living. She's teaching lab, chemistry research. Her doctorate, she skipped the master's. She went into the doctorate program. She has to pass all her classes. And when she did the presentation, she is working on a chemical formula for farmers, growers to use in their fields without pesticides. You know, it's something of that sort. I mean, I know there's some organic stuff out there already, but what she's doing has to do with farming and what they're using in the farms that will not affect the farm workers. And I didn't know about this until she told me the other day. So I'm very proud of that.
Yes, I would be proud too. That is very exciting. And, you know, as a former environmental scientist,
yes,
that gets me excited too.
I can't wait to go and visit and say, okay, show me show me these formulas. I want to see what's going
And
on.
I apologize for interrupting, but our session, we're about to cut off recording. But thank you all so much for attending this session. Thank you, Ms. Briseño. It was an awesome presentation. And we look forward to reviewing the feedback and going back and accessing all those resources. Thank you so much, everyone.
Thank you, everyone.
Thank you, Lisa.
Thank you. Bye-bye.